about 3 hours and 3 minutes. The House Healthcare Availability and Accessibility Committee will come to order. I have a substitution letter in hand from Speaker Welch. We are substituting permanent member Rep. Grassi for temporary member Scheer, and also permanent member Wynn with temporary member Justin Cochran. Minority spokesperson Haas, do you have any substitution letters? Thank you. Clerk, please take the roll.
Manley.
Here.
Syed. Here. Haas. Here. Avalar. Here. Crawford. Here. Howder. Laha. Here. Lilly. Present. Ma. Here. Morris. Here. Senalitro. Here. Schmidt. Here. Cochran. Here. Scheer. Here. 13. We have 13 members present.
With 13 members answering the roll, a quorum is present. We'd like to invite Representative Scheer to present House Bill 4642. The chair recognizes Representative Scheer.
Thank you, Madam Chair and members of the committee. Today, I present a bill about autism. It's very simple. It simply says that the doctor who diagnoses autism has to let the family or whoever brings the child, the family, give them information about how they can care for their child. I already have filed an amendment, and it was originally, the bill you're looking at says that they have to give them a pamphlet. So in this day and age, we're amending it to say a paper copy or through electronic means. Would you like me to read the amendment? I already have it. It
Sure.
isn't filed, but I do have it from LRB.
But you are planning to file it?
I'm going to file it right after committee, yes.
Do you want to read
Sure.
the amendment?
I think it'd be easier for the members to know what the plan is, if it's okay. Okay, autism-specific support services information. A pediatric neurologist or any other physician, sorry, I'm reading off my phone, who diagnoses autism in a child must provide to the child's family at a follow-up appointment information regarding autism-specific support services in paper form or through electronic means. I would surely appreciate an aye vote and happy to answer any questions.
I'd like to read in the witness slips. We have 3 proponents, that being Barbara M. Pritchard, representing Self, Jamie F., and Louis Andrade from IARF. 3 opponents, Aaron O'Brien from the Illinois State Medical Society, Jenny Pinkwater from the Illinois Chapter American Academy of Pediatrics, and Sean McDermott from McDermott Consulting. Is there anybody that would like to testify? Any questions of the committee? Go ahead, Representative Crawford.
Absolutely. I love the idea of this bill and would love to be added to it. I do have one question, though.
Mm-hmm.
Do we know where they're going to gather the information about where the autism services in that area for that patient?
So that is one thing that we changed in the amendment. Originally, it said close by or some such language, and they're going to take the location of it out because if it's electronic and they're suggesting how, I mean, you can take your child to the dentist, you don't need to go somewhere nearby. You'll just read it online.
Perfect. Please add me.
Okay, I will. Thank you.
Leader Haas.
Thank you, Madam Chair. You'll be filing this amendment following committee, correct?
Yes.
Right now, we have the 3 opponents. have you discussed this amendment with them? Does this bring them neutral?
I have discussed it with them. I mean, this is literally hot off the press, but I talked to them, and this was not only Leader Manley's ideas, but then some of the changes were theirs as well. They had a concern about where it was located with IDFPR, so they're moving it to a different section of the law where it's more appropriate.
So does it? Or
And then
doesn't-
they also did not like the word pamphlet, so I changed it to the word paper, and then Leader Manley recommended or electronically.
Okay, so we don't know if it brings them to neutral yet.
They might be here, I don't know,
Okay. So we'd be happy to hear from them. I guess while they're walking up here, another question that I have is, you remove the language of pamphlet, but continue to use the word printed. I think as we
Or,
know, anytime.
printed
Okay,
or.
let me finish my question. As we know that with any type of printed materials, whether it's in a pamphlet form or printed like this, as soon as the ink dries, oftentimes that information is outdated. How often will this information have to be updated? Who's responsible for the printing? How long will these entities have to gather this information and get it printed or put into electronic form? And I guess those are those questions, but I do have a couple more. And then
Okay,
we'll go
so
to the other
since
folks.
it's or electronic, I think that pretty much answers the problem with the paper and the ink. If they don't want to do it that way, they can just do it electronically.
But
Problem.
it's still a must, correct? Not a
But
shall.
there's a word or. They must provide the information. How they provide the information is up to the doctor. They can do it electronically, which there is no paper, ink, or any of those things you're concerned with. And then there is an organization which I think the members of this committee would really value knowing this. There's a website, it's called TAP, T-A-P, tapillinois.org, and there's a hyphen between TAP and Illinois. So if you, know of any autistic families, I'm sure that they would appreciate knowing this. I've already, just since I discovered this, had several people say what a valuable resource it's out there, and people just don't know about it. So, are there more questions?
Yeah, definitely. How often will this information have to be updated?
It's not required to update it any certain amount of time. That's up to them.
What was the reason for this?
I've had multiple constituents come and say, like for example, a very renowned physical therapist has a child with autism, and she has really had struggles with this and came and said, why isn't there anything out here? The doctor just said, my child has autism, and sent me out the door. And, this is a very, for lack of a better word, good parent, and no one gave her any information. And then, so then I've seen it happen myself as a teacher. If you don't have the education, you just don't even know where to turn or where to get help. And I know this isn't going to solve every problem on earth. I just think that anything we can do to make a child's life better and a parent's life better, it's worth it.
Sure. So again, with, I've spent, I think, close to the past 40 years in healthcare, and one of the things that I've learned with the experiences we've had with electronic means for information, that's been the easiest means to keep folks informed and to keep them updated with the most updated information as well. But I guess I would like to hear from the other folks that we have at the table and some of their concerns.
Hi there, Scott Reimers with the Illinois State Medical Society. Aaron O'Brien signed in. I'll follow up with a slip, to
Thank
make
you.
that happen. Thank you, Chairperson Manley and Spokesperson Haas. Our opposition is just continually opposing legislation that mandates what a physician has to do in his or her office. We're down to, at times, 10-minute blocks with a patient. Our members believe that they give this information out We're concerned, as Representative Haas, as you brought up, the timeliness of the information, whether it's printed, as the original bill said, to look, it could be insufficient from the day after that's printed. So there's some concerns that way. I did tell Representative Scheer that we don't believe it should be in the Medical Practice Act. The Medical Practice Act is the act that licenses physicians. There's no programmatic pieces of that act. So finding the appropriate home or the appropriate state agency is another issue. Maybe a public information campaign, based on other state resources, I don't mean to speak for other state agencies, might be the more appropriate way than mandating what a physician has to tell his or her patients as they come in. So it's kind of a philosophical opposition. We agree it's well-intentioned. We're working with many of you this session on autism-related neurodivergent issues, but at this time, we do have issues with the situation that's presented to us today.
Sean?
Yeah, and it just becomes a slippery
Can
slope.
you state your name,
I'm
please?
sorry,
for the
Sean
record?
McDermott. I represent the Illinois chapter of the American Academy of Pediatrics. We just have concerns of what's next. You're going to mandate that pediatricians discuss this issue. What comes next, and where does it end? And it's really interfering with the patient-doctor relationship, and that's our fundamental opposition to the bill.
And with this being in the Medical Practice Act, if a physician neglects to do this, would that be grounds for a complaint against their license?
Not to speak for IDFPR, but we believe it would.
Okay. Thank you for the response. Again, I think it is very well intentioned, but it sounds like there needs to be some perhaps additional work on the amendment that you'll be proposing. Will the amendment, will you agree to hold this bill to bring it back to the committee with the amendment?
I can do that. I mean, I've already read it to you, and in all honesty, I listened to them, and I didn't file the amendment until I heard their concerns. And I feel like every concern they had, they were talking about the original bill, and that's, they really weren't having concerns with the amendment, except the fact that, quite honestly, they don't want to have to do this, and I think that I'm not asking that much. And I understand nobody likes to open the door, but the door was opened 100 years ago of, if there wasn't a problem, I wouldn't be here with this bill. So apparently, not all physicians are doing what they should be doing, and they're sending parents out the door with a blindfold on, and they have no resources. And just to offer them a website, I just don't think it's asking that much, and I think it's almost embarrassing to say that physicians aren't willing to even tell their patients about a website.
So you're willing to continue to work with the folks here?
I'm
on
going
the-
with this committee amendment right here.
Has it been filed?
No, but everything they asked for, I put in it.
Okay, I guess all I'm asking for is perhaps to have a conversation with these folks before y'all leave the room and make sure that everything that we've talked about here is in that amendment before it's filed, and for that amendment to come back to the committee before it hits the floor.
Sure, I'll bring the amendment back, and I'll be happy to talk with them. I will not guarantee that I'm going to drop this, though, and that's really what they want me to do, and I just feel it's really needed.
Well, that's not what I'm hearing them ask for, and that's not what I'm asking for either. I think this is great information that can get out to parents. We just want to make sure that it gets out in the most effective and efficient way. Thank you.
The assumption is that this is not occurring, and it is occurring. Doctors do share this information with their patients, and I don't know that we need legislation directing doctors how to communicate with their patients. This is occurring. They do share this information, and I disagree with the sponsor's comment on that. They have the best interest of their patient at heart. They're going to share that information. They want them to get services. There is a lack of services in the state. We could use additional funding for those services. That's what we'd like to see.
Mr. Zoltan, are you a proponent or opponent? And I don't see that you filed the slip.
I apologize. I missed this this legislation prior. My name is David Zoltan. I am representing Disability Housing Justice.
You'll file a slip then
I will
right
file
after.
a slip
Thank you.
immediately following my testimony, and would be happy to work with the sponsor on this issue. However, I'm afraid that as somebody with autism and somebody who advocates on autistic issues, that voice needed to be heard at this hearing. This is putting the cart before the horse. We do need, and you've even heard in testimony already, that we need resources for doctors to be able to refer people to the things that are going to get people help. That's on this committee to make sure that we are raising the money that needs to happen through progressive revenue and making sure that that money gets to where it needs to go so that we can make sure that doctors have the coordinated services that are necessary to give what they need to their patients. I agree that, first of all, we should certainly not be limiting doctors to 10 minutes, and I do agree that they certainly do need to provide this information, and I have been subject to instances where doctors have not always given me all the information I needed. So I do understand the push of this issue, but again, we need to make sure that those resources are available first and foremost before we are requiring people to get this information out. And that is the key issue at stake here, and I think we would be better served dealing with that before we start to put that mandate in place for the doctors. I do believe that doctors do have their patients' best interests in heart in most situations, but we need to make sure that we're doing right by them in the first place, both the providers and the patients, by getting those resources in place.
Thank you. Representative Laha. Thank you so much.
So I have some questions, but first I want to acknowledge the importance of what you're doing. I'm a mother myself who has received a very severe diagnosis for my child, and I remember the diagnosis appointment, and you are thinking a mile a minute. Literally, your breath is just taken from your lungs, and you are looking for answers, and you're looking, where do I go next? How do I do this? So I understand your heart on this. With that being said, I do want to acknowledge not all doctors do that, and that doesn't mean they're purposely withholding information, but I have many people who reach out to me as an advocate saying, I don't know where to go, I have not received information, what do I do? And what do? We go to Google, right? We start Googling things, we start doing our own research, and that leads us down a rabbit hole, which leads me to my question, okay? This information that you're requesting of the doctors, who is going to be regulating it? How are we going to, I get a lot of information, it doesn't mean it's good information. Mm-hmm. We get diagnosis questions all the time. Like, who is going to regulate this, and who's going to be watching it and making sure that these resources that is being handed out to the patients is actually beneficial and not hearsay or not, so that's an important thing.
First of all, my heart goes out to you. I mean,
Thank you.
I taught for 35 years. I dealt with this every year, and it's a challenge, and you love these kids to death, and you just want the best for them. This is also why I left it very open-ended. The value of physicians is they do know the good resources, like they said, they do share sometimes. And that's why I left it open-ended. It doesn't say you have to give this or that. It's whatever the physician feels is the good resource, that's the resource that they provide.
Okay. I'm going to just say, feedback as a parent, that could be problematic, right? We're just saying put what you want in there, as long as you put something. I can see
And
that.
I mean, I can give the recommendation
Sure.
that this tap-illinois.org is a good resource. Now, whether the doctors want to use that or don't feel it's good.
Right.
But I mean, at a certain point, we have to do something and not just think of excuses of why not to.
Sure. I'm completely with you on that, which brings me to my next point. What kind of information should be on there? Is this therapy services? Is this medication services? Is this behavioral services? Is this, mental health services? So, I mean, this can go on, because all of those things are very relevant to a major diagnosis. And so I'm worried that things that are important are going to be left off, and then there's going to be a liability aspect on our doctors. So I love this idea. You are absolutely correct. You are so right. There need to be resources. I just don't know that without regulating that of what these resources are is very safe sometimes.
It's interesting because, first the doctors say they do it, and then we have clearly cases where they don't. And then we say we want to give resources, but then we say we don't. And so, this is just really simple on my part, is let the doctors decide. They're the professionals. The doctors have just testified that they don't want us to legislate how a doctor.
So what would be sufficient then? So if a doctor says, Ms. Shear, your child has autism, I'm going to come back with some information for you. What would be sufficient information on this type of?
The law does not specifically say you have to do this, you have to do that.
Right.
In a simple example, they could have a pamphlet if they want to do that. Mm-hmm. They could put a website on a script in the doctor's office, and they could use the TAP website.
Sure.
It's very, very inclusive.
I love that, and I get that, but I think for me, this could be something with an unintended consequence. And then what does that paper document hold these doctors liable for things that they're handing out? And so in that reason, that is my only hesitation with that. So thank you for answering my questions, and I appreciate your heart. I really do. That's very nice of you.
Representative Lilly.
We've had two experiences that the physicians have not provided information for a family member to have treatment. We had two just in this room where it has happened. In your opinion, what should be the consequences of that type of care or lack of care?
I would say if somebody feels that they've been wronged by their physician, they can always file a complaint with the Department of Financial and Professional Regulation, on their license. But we believe in to further encourage physicians and to make them aware of all services and to let them treat the patients as they choose, and to ask for follow-up questions and go from there is the appropriate to maintain physician autonomy.
When a family says to another legislator or just a friend, I don't know my child has been diagnosed and I don't know what to do. And I've been diagnosed by a physician and I don't know what to do. Where do you think that family should go?
They're more than happy to follow up with the physician. Excuse me. Their staff, their patients get back with questions, and I hope and believe that, look, I can't say in every instance, in most instances that would be provided.
In the incidents, we had two here, it's not. So I'm trying to get us to the point of the problem. Representative Shear has a recommendation to address the problem. What would be your recommendation to address the problem?
Well, additional public information would be beneficial. Maybe at the Illinois Department of Public Health or Department of Human Services, there's the ability to do a public relations campaign on the services that currently do exist and share that information broadly through various media outlets. Maybe that's the appropriate way to go. Additional funding, resources is of particular concern. But I think a general campaign to educate families that have a child with autism would be appropriate. It'd be beneficial in a larger picture. And it's not the allegation the doctor did not share information with me. How do you prove that? What happens after that?
Who do you think should do this campaign?
I think one of the state agencies, and far be it for me to tell the state agencies how to do a public relations campaign, but they would have the ability to contract out to appropriate public relations firms that could do a campaign like that. Maybe there's an opportunity to look at that. That would be, I think, far more appropriate than trying to interfere with the patient-doctor relationship and tell a doctor, you shall tell A, B, and C to a patient or the patient's parents. It gets very complicated. So,
Well, what I am concerned about is the problem. I don't believe that the taxpayer is the payer to the solution. I just don't. I do think the physicians, I know you have the Physician Medical Association to bring this issue forward, and it's not just this particular diagnosis, it's probably others as well. I would recommend that AMA and all of the medical groups come together and come up with something that addresses the problem. I know you have malpractice, because that's the next thing, but if you really want to help a child who is needing access to services, and you have some physicians who just may not know where to refer those families to, and that child goes without, I think the Medical Association, American Medical Association, would want to help that issue.
And we agree, Representative Lilly, and that is one of the first things I told Representative Scheer was, can we work on a public information campaign or something like that to help get the message out and to further educate physicians, to make sure that they're aware of that. We do continuing medical education programs for hundreds and hundreds of different issues like this and different conditions, and would be happy to look into that and do some more and make suggestions, from what we're already doing to try to educate people for free, and get it out there as best as we can.
I appreciate that response. What I do know, and maybe someone can verify, that there's an increasing number of children being diagnosed with autism. That number is changing from 10 years ago.
Absolutely.
So I really appreciate Representative Scheer's legislation as policy, what we should be doing and how we should help the providers. And I think that's what she's trying to do in a information way. So I would recommend that you continue to kind of talk this through, Representative, so that we can have policy that doesn't offend anybody, because that's what I think you're feeling. And I don't think that's the purpose of her legislation.
We understand, and I appreciate that comment, and educating providers on the newest treatments and newest services and all of that is a laudable goal, and we completely agree.
Thank you.
Representative Schmidt.
This question would be for Mr. Reimer. So currently, what type of provider would make the diagnosis to begin with? Could it just a general practitioner, or would it have to be a psychologist? What's the...
In the bill, it represents pediatric neurologist, right? I think... Yeah, okay, without seeing them, but they're all different, and it's being discussed right now who diagnoses autism. It's a big issue that we've been discussing, and with members of this committee at all the time to try to find different ways to get services to people faster.
So I would just assume, you diagnose them and then you would refer them to the professionals, behavior people, to psychologists to go from there. I would think that's already part of the
absolutely.
system.
We believe that is part of the system. Now, here's the issue. I think it would get to be, are those services available for everybody who's diagnosed? But that's a whole nother issue.
That's not
going
this
to,
bill.
that is
Yeah.
not this bill, right? That's other issues that we're dealing with.
I would think it's standard practice within the medical community. If you diagnose someone with this condition, you then refer them on to a professional to help.
We believe that. We agree
Yeah.
with that. And does it happen every time? As Representative Lilly said, maybe it doesn't. I hope it doesn't, and we need to educate people so it does.
Okay, thank you.
Representative Shear, do you have something you want to add?
Yes, I just wanted to add that the actual bill says provides that a pediatric neurologist or any other physician who diagnoses autism in a child must provide da-da-da-da. So the original bill says or any other physician who diagnoses, and the amendment will say that as well. It's right here if you're going to read it or, okay.
So here's what we're going to do. You've committed to holding the bill on second. You have an amendment that hasn't been filed, but it will be. Would you be willing to work with the opponents to get the language in a certain form that not only fulfills the intent of the bill and what you're trying to accomplish here, and then doesn't become a problem for the opponents? I think I'm hearing that they want to work toward this. Either way, your amendment will be filed, and then I'm going to have you come back to committee with that.
That's fine with me. I just have to put the caveat in that I don't know if they'll ever agree with what my language is, because I felt like I already did that. But I'll be happy to talk to them. I just can't promise that I'll do just whatever they want, because I got to worry about the autistic
I'm not saying
children.
it has to be agreed on before you
Okay.
come back. I want you to continue to work
Sure.
with them on that. There is a whole lot of
Absolutely.
problems with the lack of services. Once there's a lack of people to diagnose, and once you get diagnosed, there's a long line that comes into a funnel for services, depending on what those services are. Sometimes they're ABA therapy. Sometimes it's other, therapies. There's only, what did I hear the other, 160 pediatric behavioral doctors in the state? No, there's like
There's 20.
20 in the state, and they're very underpaid, is the other thing I heard. So we've got some real issues, and all this points toward that awareness. And unless you're living that, you don't realize how difficult it is. And I think to Representative Shear's point, families are living with this every day, and there's a lack of services, a lack of understanding, not to mention that we've got people in high places saying that it's caused by things that it's not caused by, as if it can be cured. It is not a curable condition. I mean, there's a lot of things here. And if you've met one person with autism, you've met one person with autism, because every person is so much different. What works for one person may not work for another. And so as we try to figure this out, I appreciate what you're trying to do, believe me. So we're going to go to a vote. We're going to hold the bill on second. You're going to come back with hopefully an amendment that is more suitable for everyone in the room. Either way, you're going to come back with your amendment.
That all works for me.
Okay. Did I read all that? Okay. Is there any other questions? Anybody else have anything you want to say? Okay. Seeing there are no other questions, I'm up here. Oh, thank you. There being no further debate, Representative Crawford moves that House Bill 4642 do pass. Is there leave? Partisan leave being granted, there are 9 votes in favor, 4 votes opposed, 0 voting present. House Bill 4642 is declared passed and will be favorably reported to the House floor. Thank you, Representative.
Thank you, everyone.
Next bill will be Representative Leader Avalar for House Bill 5390. You have permission to present from your chair if you'd like.
Thank you.
Let me get, do we have witness slips here? 1 second. I'm going to ask for permission to not read 153 proponents. I can read the opponent, if you'd like, Justin Roush, on behalf of himself. Do I have permission to not read 153 proponents? Thank you. Appreciate that. Representative Avalar, you have the floor.
Thank you, Madam Chair, and thank you, members of the committee. I am here to present House Bill 5390, which is focused on one simple but important goal, which is to ensure that patients receive consistent, fair, and transparent billing protections when they receive care in a hospital setting. We know that too often patients who walk in a hospital, especially in urgent or emergency situations, assume that all the care they receive is part of that hospital system. But in reality, many of the providers they encounter, whether it's a radiologist, anesthesiologist, or emergency room physician, are not employed by the hospital, but are instead independent contractors. So what that means in practice is that a patient may qualify for financial assistance through the hospital, but still receive separate bills from contracted providers who are not required to follow the same financial assistance standards. So that's where this bill comes in. HB 5390 does multiple things. First, it works to align financial assistance and billing protections across the care a patient receives within a hospital. So if a patient qualifies for charity care or financial assistance, that protection should not disappear simply because part of their care was delivered by a contracted provider within that same facility. Some other key policy reforms that we're doing here is we would like to increase the income eligibility levels from 200% of the federal poverty lines to 300% of the federal poverty lines. Eliminating the asset test. I think some of us have known about this with regards to being asset rich but cash poor, where you may have families that find themselves having to cover an emergency bill, but yet may own their home because they they are elderly who are now living on a fixed income and now don't have the means to pay their bills. So we're looking to do that, eliminating the asset test, as well as closing the loophole on hospital billing for outsourced care. We have been having active and ongoing conversations with the Hospital Association as well as other stakeholders, and I want to put it on the record. I want to thank them for their commitment to patient care. My intent with bringing this bill forward today is for me to be able to move this conversation forward. I'm continuing to have negotiations. It is my intent to bring an amendment to the bill as those negotiations continue to happen. So I want to keep my remarks short, but we do have members from the Hospital Association here, as well as Megan Carter with the Illinois Council for Health Justice, and Luvia Quinones with who is the Health Policy Director with the Illinois Coalition for Immigrant and Refugee Rights, who brought this bill to my attention to answer any questions you may have.
Hang on one second. I'm going to open the roll. Representative Ma moves that House Bill 5390 do pass. Please call on Representative Scheer. Representative Scheer, how do you vote?
I'd like to open the roll and vote yes, please.
Thank you. Who would like to go first? For testimony,
Yeah.
Dave, go ahead.
Thanks, Chairwoman. Yeah, Dave Gross with the Illinois Health and Hospital Association. I'll be quick because we have worked for the last couple of years with the sponsor, and this is amending the Hospital Uninsured Patient Discount Act. This is really a gold standard act. Doesn't exist anywhere in the country. For those of you that were around when Attorney General Madigan issued this law, it's a strong law. It allows the uninsured patient to be screened and then to see those discounts. The legislation has a lot going on in it, and we're in discussions with it right now. The main problem with this bill is that you're asking one private business to regulate another private business. So I think the sponsor mentioned that these specialists, that many hospitals can't afford to have specialists on on their payroll, so they contract with them, these anesthesiologists or these radiologists or the emergency physicians. So they will send that bill out. Well, a physician group is not under HUPTA, okay? It's the Hospital Uninsured Patient Discount Act. So what the bill does is asking a private business, a nonprofit hospital or investor-owned hospital, to regulate another private business. And that's almost impossible. So we have a big disagreement on that provision. We've worked with the sponsor on improving the screening of uninsured individuals. We've worked with them and the groups here to my right on moving uninsured patients from health centers to be screened for higher acuity care to the hospitals. We spend a lot of time educating our hospitals on these changes that are just recent. These have all been done in the last 2 years. So with everything coming at hospitals now, with the cuts that are coming, the redeterminations, the HR1, we expect 300 to 500,000 individuals to be thrown off the Medicaid rolls in the next year. That is a lot coming at hospitals when we look at this bill. So again, I want to be short. I want to respect the sponsor. We've worked diligently with her for many years, and we'll do our best we can. But at this point, we have a long way to go to be able to reach any kind of agreement on this bill.
Go ahead.
Good evening, Madam Chair and members of the committee. My name is Luvia Quiñones, and I work at the Illinois Coalition for Immigrant Refugee Rights, also known as ICER. I did submit a written testimony, so because of time, I won't read all of it, but there are, you could say, it's accessible there.
Why don't you just give us the highlights?
I'm going to share two things. One of them is a story.
Sure.
Which is one of many that we have received over the years. It's an individual that went to one of our member organizations called Southwest Suburban Immigrant Project, also known as SSIP. Jose Guadalupe Rangel Gil, who's 35 years old and uninsured. His family's income is $42,000. Mr. Rangel Gil went to his local hospital due to a severe stomach ache. Once admitted, he learned his appendix had burst and needed immediate surgery. After he was discharged, he began receiving many medical bills. In October of 2025, that's when he contacted the organization SSIP, if they could assist him. With their support, they helped him apply for hospital financial assistance, and he did qualify as well as received a 100% discount. Then he began receiving many other bills, from 5 to 6 different medical groups. Some of those bills were forgiven once the organization showed that Mr. Rangel Gil was eligible for hospital financial assistance, but 2 of these providers continued to deny any kind of discount. One of them is Suburban Radiology, who has billed him for $1,575. These were all medically necessary services, all provided within the hospital. This is just one of many stories that highlights how a person may go to the hospital emergency room. They do not know if the doctor is staff,